Compared to when you were growing up, do you think children's physical health is better, the same, or worse off?
Worse off.
I think there's a lot more risk because of environmental causes, and then of course with family structure degradation. It's pretty tough out there for kids in general.
I think we don't really have them out exercising as much as we used to. We're not really as focused on healthy eating habits.
I was going to ask you about mental health as well.
Mental health?
Do you feel the same way, that it's...
I really do.
Compared to when you were growing up, do you think children's mental health is better, the same, or worse off?
I don't really know.
You don't know?
No.
Well, I grew up in the 60s and 70s when I think families were more intact then. There was more consistent support. Of course, the violence in families was more hidden then. It wasn't out as it is now. But I think kids struggle much more, and it's difficult for them to access assistance that may be available to them because they're kids. They don't know, and they have to rely on the adults around them who may be the ones who are, the ones that are
doing the damage.
Doing the damage. Thank you for filling in the blanks. Yeah.
And do you think Congress is paying too little attention, the right amount of attention, or too much attention to children's health these days?
Probably too little.
Too little?
Yes.
Do you think childhood health plays a vital role in our adult health, our adult life?
Yes, absolutely. Of course, you can see kids going from 5 to 15 to 25, just blink of an eye, The kids who are struggling, as 5-year-olds, 10-year-olds, 15-year-olds, and before you know it, they're adults. And of course, most of them will carry on what they've known as children. There are there's a wonderful resilience in children too. But I think they need more help. We need to fund health care, mental health, physical health so much more than we do with children.